Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is September 29, 2025. This video is on 4 articles, all published on August 30, 2025, 3 in JAMA, 2 original JAMA articles, and 1 editorial, and 1 article in the New England Journal of Medicine on the RSV vaccine. The NEJM study was RSV pre-F vaccine in older adults. RSV causes substantial morbidity in older adults, often triggering hospitalizations for respiratory and cardiovascular illness. They used a bivalent RSV prefusion protein-based vaccine developed to prevent lower respiratory tract illness in older adults. This is a phase 3 randomized double-blind placebo-controlled trial, the RENOIR trial. 34,284 adults aged above the age of 60, mean age 68.3 years, 49.9% were female, and 37.4% had greater than one coexisting condition. Follow-up, median follow-up 6.7 months during a single RSV season from 2021 to 2022. Outcomes evaluated vaccine efficacy against RSV-associated lower respiratory tract illness with greater than 2 symptoms was the primary endpoint, and hospitalizations was the key secondary endpoint. Statistical analysis was utilized to evaluate vaccine efficacy. 95% confidence intervals were calculated. What did they find? The primary efficacy, the vaccine efficacy was 66.7% against RSV-associated lower respiratory tract infection with greater than 2 symptoms. Hospitalization reduction, vaccine effectiveness 85.7% against RSV-related hospitalizations. Efficacy against RSV with more than 3 symptoms, equal to or more than 3 symptoms. Vaccine efficacy was 88.9%. Subgroup consistency, efficacy consistent across age, gender, and comorbidities. Limitations of the study, single season follow-up, no assessment of long-term immunity or cardiovascular outcomes, underpowered for rare events. Key takeaway, RSV prefusion vaccine significantly reduces the burden of symptomatic RSV and hospitalizations in older adults. It supports wide uptake of this vaccine. The next study was a JAMA study, RSV prefusion protein vaccine and cardiovascular risk. RSV increases cardiovascular disease via inflammatory prothrombotic mechanisms. The vaccine evaluated as a bivalent prefusion F protein vaccine, recently approved for RSV-related lower respiratory tract illness. The study designed pre-specified analysis of the DAN-RSV trial, pragmatic open-label randomized 1:1 conducted in Denmark the winter of 2024 to 2025. 131,276 adults aged above the age of 60, mean age 69.4 years, 50.3% were male, 21.8% had coexisting cardiovascular disease. Intervention, 1 dose of RSV fusion vaccine versus no vaccine was the control. Follow-up, median period 22.4 weeks. Outcomes assessed from 14 days post-randomization to May 31st, 2025. Statistical methods, incidence rate ratio, IRR, vaccine effectiveness, Poisson models, and intention to treat approach. What did they find? RSV prefusion vaccine reduced all-cause cardiorespiratory hospitalizations, 26.3 versus 29.2 per 1,000 patient years. Vaccine effectiveness 9.9%, p-value 0.04. Cardiovascular outcomes, no significant vaccine efficacy for isolated endpoints such as stroke, MI, heart failure, or atrial fibrillation. P-values not significant. Absolute rate reduction, 2.9% fewer hospitalizations per 1,000 patient year. Number needed to vaccinate was about 345. Subgroup effects, vaccine efficacy consistent across age, gender, cardiovascular disease subgroups, no significant interaction. Not powered for cardiovascular outcomes, open label, no systematic RSV testing, limited generalizability. Key takeaway, RSV pre-fusion vaccine may offer modest but meaningful protection against downstream cardiorespiratory events in older adults. The next study was a CDC study on RSV effectiveness in older US adults. 2 approved RSV vaccine, RSV pre-fusion Pfizer and RSV pre-fusion 3 GSK, were introduced in older adults for 2023. The study design was prospective, observational, test negative, case control study over 2 seasons, July 23 to April 2024. Study cohort 4,488 adults above the age of 60 hospitalized for acute respiratory illness across 5 states in the US, including California, Colorado, New Mexico, Oregon, and Tennessee. RSV cases were confirmed by RT-PCR. Vaccine effectiveness was evaluated. Follow-up duration, 2 RSV seasons with ongoing weekly surveillance. Statistical adjustment including logistic regression for controlling for age, race, comorbidities, time, and region. What did the CDC team find? Oral vaccine effectiveness 58% against RSV-associated hospitalizations. Age stratification, vaccine effectiveness 61% for ages 60 to 74, 51% for those above the age of 75. By vaccine, RSV pre-fusion Pfizer, vaccine effectiveness of 58%, RSV pre-fusion F3 GSK, vaccine effectiveness of 59%. Time since vaccination, vaccine effectiveness remained above 50% for up to 6 months post-vaccination. Limitations of study, observational design, potential residual confounding, sample size limits, stratified analysis. Key takeaway, early post-approval data supports moderate to high effectiveness of both RSV vaccines in preventing hospitalizations. The accompanying editorial said, RSV is a major under-recognized cause of decompensated heart failure and COPD exacerbations, drives inflammation-linked cardiovascular events. Vaccine insights, pre-fusion F protein-based RSV vaccine reduces severe respiratory illness. Early trials showed 80 to 85% efficacy. The DAN-RSV trial, large Danish trial, over 130,000 individuals, showed 9.9% vaccine effectiveness for cardiorespiratory outcomes, but not powered for specific cardiovascular endpoints. Editorial caveats, there was no RSV diagnostic confirmation. It was a single season follow-up, limited generalizability beyond Denmark, and overlapping endpoint definitions blur interpretation. Key takeaway, RSV vaccination likely prevents broader cardiopulmonary disease, even in those without known cardiovascular disease, warranting for further focused trials. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.